This is Dr. Justin Dorenzo for session 2 of our anger management course. Today we are going to be talking about identifying events and cues to anger. I'd like to welcome you back, and first I would like to review what we did last time, as well as think about the exercises that you completed for session 1. So remember that we talked about the difference between anger and aggression, where anger was an emotion and something natural, whereas aggression was a behavior and a choice. And we also learned about different myths about anger that we've probably grown accustomed to and learned throughout life, and hopefully we are able to counter some of those myths and offer some evidence that those myths are not true. We also mentioned a couple strategies of avoiding anger, such as relaxation and timeouts. And if you remember, I mentioned that just thought stopping doesn't necessarily work. You can't just tell yourself not to think of something. You have to use a distraction method as well. Then the anger meter, which was a way for you to monitor your level of anger. And what I want you to do, at the end of this exercise, you're going to continue to monitor your anger meter as well, so we can see if there's improvement throughout the course. So let's check in and let's look and look in our assignment and see what the highest number that we reached on the anger meter this past week. And let's think about the situation and maybe what we could have done differently, as well as maybe during the time that our anger flared the highest, let's think about how we justified our anger, and then maybe how we self-corrected and what technique we used. Alright, let's go into session 2 and let's talk about events that lead to anger. So we know that there's so many different events, so many different stressors that can lead to anger. And these events we encounter every day, and they put pressure on us and trigger our anger, from a minor traffic jam to false rumors about us, to things just not moving quickly enough, or people not completing assignments or doing things for us, or maybe somebody not calling us back in a quick enough fashion. So our goal is to make that trigger more resistant to these events, but first we must identify these events. So what we want to do again is not be triggered, or make triggers less resistant, and also not be triggered by triggers. So let's take some time. First we got to identify events that lead to anger first. So let's take some time reflecting, even by thinking or talking to someone, about specific events that lead you into anger. But before you begin, I want you to keep something in mind. I want you to try to describe, either to yourself or to someone later, try to describe these events without any opinion or interpretation. Just state the facts. So let's think of something that caused us to be angry, but rather than having the emotion and making any judgments about it, let's just state the facts. For example, instead of saying, my friend didn't want to talk to me yesterday because he didn't answer my phone call, I want you to come up with things like, my friend didn't answer my phone call yesterday. So you're just stating the facts without putting any judgments on whatever the thought is. And just focus on part of the thought. So when using this strategy, we leave no room for false perceptions or interpretations. It is only from the facts that we can begin to analyze our anger. So now that we've boiled down these angry episodes down to facts, and this takes practice. Okay, and this is really what we do with maybe you've heard of cognitive behavioral therapy, where we are refuting some of our irrational beliefs about certain things, and that's often when we want to just focus on the facts, what really happened, and not the value judgments that we put on them, because often we misinterpret events and we give them more meaning than they need to, and the same thing happens with anger. So now that we've boiled down different angry episodes down to facts, or now we're going to work on doing this, we can further describe them by becoming aware of the 4 cues that lead to anger. And we typically have 4 types of cues. So physical cues, behavioral cues, emotional cues, and the cognitive cues or thoughts. We're going to go in each one. So 4 cues to anger. Physical cues. These cues refer to how our body reacts when we encounter an anger-stimulating event. For example, our heart rate, tightness in chest, sweaty palms. So try to identify some physical cues that you experience after encountering an anger-stimulating event. The next type, behavioral cues. These cues refer to how we act or behave when we encounter an anger-stimulating event. For example, we might yell or scream, fight, slam doors, try to identify. So let's try to identify some behavioral cues that you can practice after encountering an anger-stimulating event. Emotional cues. These cues refer to the feeling we get when we encounter an anger-stimulating event. Okay, again, so the feelings. Practice calmly asking yourself, how does all of this feel? Take some time to label the emotion you're feeling with words like abandoned, afraid, discounted, disrespected, guilty, humiliated, impatient, insecure, jealous, or rejected. And again, these feelings often come after we've put some value judgment or some thought on what has happened. So try to identify some emotional cues that you feel after encountering an anger-stimulating event. This will keep you honest with yourself and will limit confusion. Cognitive cues. So these cues refer to the thoughts we have after encountering an anger-stimulating event. These cues are hard to identify because they are highly habitual. It seems like we don't even choose to have the angry thoughts we have. So let's try to become aware of the content and tone of your angry thoughts. Also, become aware of angry fantasies or schemas and images that you may have. So sometimes when we get really angry, we actually fantasize about hurting someone, hurting ourselves, destroying property, and things like that. So that can certainly be a cognitive cue that you are about to be really angry, or that you're getting angrier. So try to identify some cognitive cues that you practice after encountering an anger-stimulating event. This will help us become aware of our habit of an angry thinking. Now, I know that we've been covering these pretty quickly. You certainly have time to go back over them and look at them. And spend more time analyzing how you are cued, how these triggers cue your behavior or your anger specifically. So, but let's think about. I have some exercises for you here in session 2. I want you to list 3 over the next few days, next week. List 3 of your most recent episodes of anger, but rather than draw conclusions or make interpretations about the intent of someone else's behavior, I want you to only state the facts about the event. So you're going to do this moving forward over the next week. For example, as we discussed in this session, I want you to describe an episode using facts and what the facts would be. For example, my friend did not answer the phone when I called. Okay? Rather than my friend did not answer the phone when I called because he did not want to speak with me. Alright, next I want you to list 3 physical, behavioral, emotional, and cognitive cues related to anger that you've experienced over the next few days or the next week. And then for the next couple of days, I also would like you again to rate your level of anger every time you notice that you're in a situation of stress. I would like you to write down the situation and cues you experience, as well as your level of anger according to the anger meter. So let's work on these exercises over the next few days or the next week or so, and try to really spend some time making an effort at managing your anger and becoming more aware of what cues it and makes it worse. This session has now ended.